Silver Star is just an excellent organisation. It's one that I'm really pleased we've got a strong association with. It's a relationship that we've been building now for well over a year, and this is the second time that we're supporting the really important campaign around the time of Ramadan.
I'm a Muslim and I've also been diagnosed with type 2 diabetes for the past 3 years. During that period of time leading up to Ramadan, I've always sought medical advice from my GP on whether I should be fasting or not, and taken that advice on board. Again, I've done it this year, and the advice I've been given is the worst possible thing for a diabetic to do is to fast for 18 hours a day in the middle of a British summer, and I'm taking that advice on board.
Silver Star are truly impressive in what they set out to do. Their first priority is about outreaching to mainly the South Asian community to talk about diabetes, to raise awareness, and crucially to get people to come forward for diagnostic screening, because the first job of managing diabetes is to get people early and then to help people to understand what things they can do through diet and exercise that might ameliorate the type 2 diabetes altogether. The second thing that they're doing, and it's the pertinent time of the year, is to highlight the health risks associated with fasting during Ramadan if you are unwell, and their particular emphasis is on type 2 diabetes. And so diagnosing people is important, but it's also working with the community to get people talking about diabetes and removing a degree of cultural stigma about people coming forward and setting out medical circumstances why it's not appropriate for them to fast. Fasting is really dangerous for people who've got unmanaged type 2 diabetes, and it exacerbates some of the truly horrible aspects of the disease, which include blindness, amputation, and of course premature death.
I think it's important for communities out there to understand that fasting for Muslims is essential, but your health comes first, and you do not need to feel guilty for not fasting because of health reasons, because fasting for long periods of time in the summer for somebody who's suffering from diabetes can lead to other health complications. So it's important to take, not just to seek health advice, but to take that on board. I think it's also very important, as someone, my late father was diabetic, my mother is diabetic, it's also important to guide your parents and advise them of the potential risks associated with fasting whilst being diabetic during Ramadan. It's important that our parents and our elders also realise the potential complications around health complications that can occur as a result of fasting.